The biggest benefit of having all the equipment here is that you don't have to go anywhere. So for our team, it's really challenging if we have these patients where we need to do this diagnostic imaging and we need to move the patient. And of course, also some of our team members need to go there because otherwise you cannot check if the image quality is as we like it and if there are some errors or if we need to redo the imaging because it does not fulfill our standards. So that's why we also need to go, staff needs also to go there. So that's logistics, it's very complicated sometimes. And of course, if we can do imaging here in the vault, it's much easier for all of us. And I think for us, it also added a benefit that for other bronchial brachytherapy, where sometimes because the logistics were so complicated, then we said we prefer to do a 2D approach. Now for us, it's so easy to do a 3D planning. And I think that's where also when the benefit is there for the patients, because you can do a better treatment plan if you have better imaging. So regarding the outcomes of our patients, since we use the ImagingRing, we feel much more secure for what we do, which means that in liver brachytherapy, where we apply these very high doses, it makes also feel us doctors much safer if we can verify the catheters right before the dose delivery. We can do an image fusion with our planning CT, which is acquired in interventional radiology, maybe sometimes half an hour or even an hour before. And so this is like, as you all know, the standard already in external beam radiotherapy. We now are introducing this also to brachytherapy. What makes the Elekta Studio unique is that I think I really love that it's really mobile. And that's not only printed on the flyer, but it really is. Because when you purchase the system, it comes on a truck and then you can take the tablet and move it inside your vault. You can actually do anything with it. And that's really nice because every brachytherapy vault is very different. Ours is a bit small, so we don't have much space. And so that's really handy that also for different indications, you can use different setups. And because it's so mobile, you can really use it and turn it around and do very different stuff which you need. And of course, every clinic has own logistics and own indications. And I think that's a huge benefit which you have, that you can use it in a very diverse way, which is not possible if you have like a CT or something, which is in place and takes a lot of space.